fun, everyone? Yeah. Are you sure? Yeah. Okay. You want to break silence here, bro? Wonderful. Thanks, everyone. We've got a great panel here, but before we get started, 10 seconds of intros would be useful from all of you.
First, hi everyone, I'm Adam Higgins. I lead the commercial medical excellence team at Janssen in our region.
Hi, good late morning, just before lunch. Gorana Dasic. I'm Global Medical Affairs Head for the Kedrion. More than 25 years in medical affairs, so I'm talking about transformational changes. I think I saw lots of them. I'm in this company 2 years, but before that I was 7 years at Pfizer, so I think that I saw this big pharma and the company that I'm now, where I'm basically building, medical affairs with a team. So a physician by training and scientist, so also bringing that patient perspective, I think, very strongly.
I'll do it next. So hi everyone, I'm Evangelos. I come from a company called Incyte, and I do medical effectiveness and operational excellence for the international team.
Wonderful. Now that we are done with the intros, Adam, you have a very interesting role, and I want to kind of pose the first question. You sit between medical and commercial, which means you do your drilling in tapping
Every day.
So, where do you see the most friction between these two functions?
Yeah, no, thanks for the question. And there's been a lot of talks about it, I think, all today. So I've probably got a few practical kind of points I want to raise. I think, and this is not a new problem. I think these friction points have existed for some time, and for good reasons, because we're a regulated industry. We have appropriate firewalls between how we should operate. But it can cause challenges in front of the customer. So one of them is responsiveness. So how do we respond quickly and efficiently to the questions that our clinicians have? Because sometimes there are grey areas where our commercial teams aren't sure who should be following up, who should be owning that follow-up, is it medical? And that is something we want to try and improve upon. And the way to improve that is to kind of share those strategic plans up front, if possible, so we have some level of coordination, but also be super clear on roles and responsibilities at the account level. And where I've seen it work really practically is where you have like a cross-functional account team meeting every 2 months. And it's almost like a deliberate meeting where you talk about the account holistically. And then you can triage requests, you can understand activity in a more appropriate way. The second one is more about balancing the need to be compliant with the need to be customer-centric. And I say that with a smile because most people in this room probably have a friend or a sibling or a parent who's a clinician. And clinicians, HCPs, they're just people. So we don't want to annoy the people we want to talk to and create value with. And I'll give you an example. If a medical person goes to see a doctor on a Tuesday and has a great interaction, and then a sales rep goes to see them on a Wednesday and has no clue about that interaction or what was spoken about, that's really annoying, like really annoying to a clinician. So we put a lot of effort around sharing the plans up front, making sure we have complete visibility of those interactions to kind of avoid those friction points. And I think someone spoke about it this morning around moving away from the hero culture, because sometimes, I love that hero culture. But the hero culture exists because we have different goals and objectives that aren't shared. So having more common objectives that we can share between the teams would be super great.
If you had to throw out one thing, what would you do? One thing in that's causing that friction and what's kind of driving it.
I mean, if I had a magic wand, I'd love to have a set of shared objectives between all of our customer engagement groups around the clinician. So what's our scientific objective? Where do we want to take that clinician? How do we want to support that clinician? What kind of value do we want to bring to that clinician? And have sort of cross-functional objectives. I mean, that's kind of the dream, right? I think the reality is sometimes more tricky to share.
Gorana, for you, what is the biggest misunderstanding you believe is existing between commercial and medical? I mean, I know that the commercial teams feel that medical is only there to approve slides, but what is the real challenge?
I mean, as I said, it's 25 years I'm doing medical affairs professional, so I saw it when medical affairs was really so-called supporting function. We were doing what marketing needed to be done. And then evolving to the function that it should be strategic partner And we talked about it before launching the product, you know, but then after, and I think we talked about, market access, but more importantly, HORs. This is after the first script is written, we collect this data to understand how physicians are actually using the product. And I think this is the richness and showing the value when you build your value dossier. This is the evidence that you're bringing to the payer, whoever needs to evaluate, value of your product. So I think that I saw that, but then, so this is my perception, but then working in different companies in different stages of understanding what is the medical affairs. So I worked in a company where it was quite clear what medical affairs is.
Separate silo?
No, it was, it's a different, I really see it as a, highway, it's a one road, takes you somewhere. Sometimes line is a full line, sometimes we can cross, sometimes it's a double full, but I think it is, needed in our, ethical, business that we are doing. And this is where medical affairs exist. So I think it's just this understanding that although we maybe won't be able to share whatever, we strongly collaborate. We are the partner because we cannot exist separately. Medical alone, marketing alone, market access, HR alone. So I think that this is what, sometimes you change, difficult because change is difficult. And, if you've done it for many years and you used to do it, the way, being the change agent that I'm finding myself now, it's very, very difficult. And you question yourself, can I change the people? Do I need to change people, or these people are willing to change to understand? Both from medical affairs and marketing or other colleagues. I'm not, I think both functions need to sort of embrace different setup of work.
But you brought up an interesting point that they have to coexist.
Yes.
And you went around the people centricity part. That it's at the end of the day, I think. Carlos was talking about being people-centric, and
exactly.
Don't forget the people. And that leads me on to a very interesting question for you, Evan.
Sure.
We've seen meetings, dashboards, KPIs that don't work. Okay, I'm being a bit provocative because they never seem to work in getting these two functions to align. But do you really feel that they make them work collaboratively, or do they figure out a better way to argue more collaboratively?
That's a very good question. So it's already, you gave the answer for me, so it's the no. So you're the provocative one here. I believe that they could work, but I mean, we put our hopes too high on this. So for example, you have meetings and you hope people will share, but it's not guaranteed. You create dashboards, but what you're measuring sometimes is just for the measuring sake, but not for something in particular. So I think that in order for these elements to work, we need to have something else in the background that's more the baseline. And I'm talking about robust governance. I'm talking about really interdependent goals between the functions. I'm talking about accountability and obviously a culture, a real culture in a company where teamwork is kind of like enforced in a way, not on a SharePoint, not on an intranet, but really enforced. And when you have those elements, I think collaboration could really, really thrive, and it thrives by design and not by chance. Right? So, okay.
So who would you want it to be driving the change? Because we've always spoken about, I think we've spoken a lot about the top execs driving the change, but we are the change, right? So and that kind of drives me to a very question to the entire time. How are you going to make it work? I mean, you said you've got the cams and the SAM somehow aligned, thrown into a room. We discussed this before on how you're making it work. And you are coming new into a function, into an organization which is a complete different silo. You have dwelled in dashboards and KPIs and trying to make them align together. So, Gorana, for you, what are you going to do to make it work within your organization now?
I think I always say to the team, any cross-functional partner will understand or appreciate when we show that you're bringing the value. If they see, I need medical at that meeting because medical will give me some information that will make my job, my objectives, better, more insightful. So I think that this is for me is the key for my function. Like what we are doing needs to be something that's really adding the value. Not only in cross-functional, in internal company, but it is also this external. So one of the things for me, it is what? It's a content. We are internal and external experts of our medicines, of our treatment, of disease area state. This is the key. This is like a foundation. And then all this how we are going to educate, communicate, publish. This is for me, it's all wraparound that changes. AI today, all the others before, typing machines 20 years ago, I don't know. It's, for me, this is just how. But core is what? If treatment is working, great. If treatment is not working, you cannot do much. It's, okay, maybe you can. But at the end, patient is the one who will decide. Physician can prescribe, but patient is the one. Said this works for me, this does not work for me. Give me something else. Try something else. And physician will need to find something else. And this is where the choices are coming. I always said physicians, they want choices. They want choices because every patient is not reacting the same on the same product, treatment. So I want to have more choices as a physician, to be able. So I think for me, it is what is the core. What is that we are doing in ethical business? A treatment, And then how it's all, most of the things that we are talking in these 2 days, how we are delivering more effectively.
Very straight question. What is one thing you go back to your organization, and I want the audience to kind of reciprocate that later and think you would want to change in your organization?
I'll take that.
You take that.
Yeah, right away. I would say right away incentive plans. I mean, the way we reward people is so important, and if you reward the right behaviors, this is what will get done. What gets rewarded gets repeated. So I think for me, if it's just one, it will be that.
Adam, for you?
I'm a bit of a realist, Vishal. So I think the idea of having shared medical and commercial objectives in the short term is probably a bit far away from us. But having an ability to plan cohesively together at the start of, let's say, like a campaign cycle, right? And understanding what the teams want to communicate and when, upfront is super important. So what events are happening, when are we planning interactions? And that is getting a lot better in terms of how we show up in front of the clinician. And the second is invest in that pre-call. And not just the boring pre-call we've done for the last 20 years. Invest in what the information is that you need each team to understand and know. So when you show up in front of the clinician, it's coherent, coordinated, and you derive as much value as possible.
Dario spoke a lot. I remember Dario spoke about in Vienna about omnichannel media, and Dario, I got a lot of hate mail because of that. But leaving the buzzwords aside, if you had to really go and act, you had to be bold in Janssen, you had to be bold at Kedrion, you had to be, making that, knowing the repercussions, what would you want the audience to remember? These are 3 words you had to say 1 word, and you had to say 1 word each. And you 1 word.
Coordination.
Coordination, okay.
Yeah, maybe partnership. Partnership.
Governance.
Coordination, partnership, governance. There's no technology anywhere, I didn't mean that. Good one, I love it. And there's no AI also, so take that as an important takeaway. It's not about technology, it's not going to be about Gen AI. Okay. We've got a Slido here. Can somebody please bring up the Slido? There's a question for all of you as well. And I want to see how that word cloud evolves. But that's been interesting. We were debating before that if we had to really dwell deeper into this topic, this is going to take ages. We need a separate conference to resolve the medical and the commercial divide. We all agreed that we will never come to a conclusion here because we still operate pretty independently. I don't think, and I will probably pose this question back into the audience to see, and just do a retrospect on how your medical and commercial functions work. Incentives, he said, was a great plan. What is about you?
I mean, independence is important, for medical affairs. I think that we need to feel that when we agree cross-functional strategy for a product or treatment or medicine, we should be in medical affairs feeling independent, that you're developing activities that we feel from medical point of view.
One word.
Oh, sorry.
We love to talk in pharma. 1 word. Incentives, What's for you?
Priority?
Priority, Khanna.
Adverse incentives.
Wonderful. Let's see what's showing up here. Firewall. Eliminate firewall to enable real collaboration. That's very, very intriguing. Okay. So we all believe there's a firewall sitting. Can I see a raise of hands on who all believe there's a big firewall in your organizations stopping the collaboration? See, there are very few people who are still bored, still thinking about it.
But I think that firewall, it's a compliance issue, so you need to implement. It shouldn't prevent conversation. Nobody said you cannot talk or you cannot, Firewall is there for the compliance, for audit purposes, because we're ethical business. So I think, but this shouldn't be the excuse for either function, medical or marketing, not to talk. Oh, I cannot talk with the medical, or medical cannot talk to marketing. We need to talk, for sure, in a compliant way, understanding, what is appropriate. Yeah.
That's interesting. Talking, people, being centric, separate time cycles. That's very interesting. Have you seen that ever come up?
Yeah.
I'm seeing this here. Digital as a function.
But I think we also have to be real, right? These things exist for good reasons, but you can be human about it, right? So, if I had a magic wand, I'd love to center all of our teams around the customer, right? Not around the brand, not around medical, not around commercial. We can't because we're regulated in terms of how we operate. But when you're planning an engagement cycle with a clinician, it doesn't mean you can't talk to medical. The problem is it doesn't happen organically. If you ask people to do it organically, sometimes they don't even know who the medical person is in their territory. Maybe, right? And it's like, how do you force a structure that allows that cross-functional working? And I think there are really good practices around how to bring those people together in a cross-functional manner routinely. And then obviously the use of Gen AI and all these different tools will also help enable some of that as well.
Wonderful, thank you so much. I wanted to just leave you some last takeaways for the audience here. Can you come back to the slide, please? In terms of going back and thinking about what you want to change within your organization, right? We all come to these conferences, we think about change, we want to do the change, but we go back, we really don't make the change that is potentially going to make an impact, right? So there is a key takeaway slide if somebody can pull up the, yeah, thank you so much. Okay. I think it's time to really act as one, let's not start doing the alignment on slides and PowerPoint decks and in meetings that we are sitting around. Go back to your audience, to your medical and commercial teams and ask them, what is that you want to do to act as one? As leaders, all of you, are empowered to do that, I presume so. So go and think about what is the clear ask you want them to do. Help your field things, right? Because I'm forgetting the name, gentleman who mentioned that we are trying to be patient-centric. Probably Lord, I remember from a long time ago, he was a big proponent of that we still are talking about patient-centric. Patient is the customer, I saw from one of the slides there. So, any questions from the audience, which is, I think half of them have gone for food, but still, the hungry souls have left, so.
Any questions at all? Hand up quickly. No, all happy? I think we're happy.
Well, then we can be before time so that people can run out. There's a question there.
Question where? Gentlemen.
Oh. Florent, keep it easy for the audience.
You know me. A quick question, because we are talking a lot about the feet. But can the feet dance the same dance when the two sides of the brain don't talk to each other? Is the problem not in the head office instead of being in the field?
I think that the firewall was that idea, and I think that what was mentioned, really collaborate in execution. Really knowing what you're doing and sharing that, because at the end of the day, physician does not care. Is it the marketing? Is it sales? Is it whoever it is? They want answers. They have questions. They want answers. They want answers that enable them to do their job the best they can. How it will be delivered, it's on us to find appropriate function, appropriate way to do it. So I strongly believe in that collaboration, partnership, but with understanding of the rules and roles. So I think for me, this shouldn't prevent talking and, partnership and collaboration, as you mentioned, like when we are doing, planning the activities.
But I think you're right, it does start in the head office. And we, the last 2 years, I've partnered heavily with our medical affairs colleagues around planning, which sounds like a really boring thing. I'm not talking about GenAI, just basic planning. What's your scientific objective for a certain brand? How do you plan your messages and campaign? What do you want your people to do? And then from a commercial lens, we don't talk about selling because the firewall, we explain activity, types of events, just from the beginning, so the content and messaging and how we show up is more aligned with it. Because once that's been set, then your field-based teams feel more comfortable that at least their guys in the head office are talking to each other. You're right, it starts with that, and that's probably where the firewall exists, because everyone gets given different plans.
Any particulars from you?
I would like to add that was spot on, right? So I think it's a very good question. It depends on which level we're looking at the situation, right? But if we take it as a simplistic approach here, it starts with knowing what the right sensor is in the field or in the real world to set a KPI on. And after you do that, I find it's about creating the interdependence required. And this is why I said before, the incentive plans are so important, because if you could reward what you want people to do, and you know exactly what the outcome you want to have is from the external world, so it's a good sensor of what you're trying to gauge, I think then it's much more easy. And yes, indeed, it starts at the head office to set the scene, and then you can push it out